I just want to start. I am a data geek. So that said, if you want to chart a path to achieve equity, you're going to need a map. So before we begin, I want to actually let you know that these data and information are presented with humility. The kind of questions that you're going to raise, the answers that we give or we can provide will likely lead to more questions. And we also want to activate your neuroplasticity. It's kind of like brain burpees. So we'd like to orient you to 3 conceptual pillars to help you on this journey, particularly for this conversation that we're having. And that is, we want you to think spatially, we want you to act locally, and we want you to learn collectively. This is just a quick acknowledgement of the scholarship, the scholarship that has informed our perspective both in academia and in art. Everything I wanted to learn from Dr. Bronfenbrenner is actually covered in Stevie Wonder's Living for the City. And I say this in no way to denigrate Yuri's work, but to really let you know how impactful Stevie's art has been in the formulation of my understanding of the family protective factors and those external social and civic drivers that impact human development. So hopefully today you can actually, oh, I'm being told to put my camera on. So sorry, I took Bill's, there you go. So hopefully now you can see me. Okay, great. So this is just a quick, again, just want to move forward here. Let's see here. Some of the crucial questions we want you to hold in your mind as we go through this is, and there are 4 of them. So which neighborhoods are most in need of support for early child development in your city? What are the root causes of the equity challenges that we see? What are the potential solutions to address these equity challenges? And what can we do as communities, stakeholders, policy makers, and individuals to improve outcomes and reduce disparities in children? Now, one of the core ideals of America is that everyone should have an equal opportunity to realize their full capacity. Unfortunately, rising rates of inequality are stifling the opportunities that children have to realize their full potential. The forces of inequality take their toll on children from the very earliest stages of their lives. 2 of the most important, powerful social indicators of inequality are those associated with wealth and income segregation, and race and its related dynamics of discrimination. So there's a lot of information that we'll be going through that we don't really understand fully. We're getting into complexity science. Given the nature of human development and the exponential patterns of growth and development, small differences in either good or bad exposures tend to compound over time. So gaps in equity tend to grow and become even greater as children get older and move through school and beyond. So that's why achieving equity from the start of life is such an important social, educational, health, and cultural goal. I'm going to introduce some concepts to you, but before I do, I always like to quote the greats here. And if you all have read Jonathan Kozol, I encourage you to do so. Savage Inequality, it's a great book. So long as these kinds of inequalities persist, all of us who are given expensive educations have to live with the knowledge that our victories are contaminated because the game has been rigged to our advantage. So let that sit with you for a second. We are, as all of us know, we're living in very interesting and historic times. Unfortunately, challenges are only accumulating and accelerating. This is why I will continue to commend you and thank you for stepping up in this way. To accelerate learning, and maybe that this kind of accelerated learning can outpace the growth of the chaos. But these are just a few of the challenges kids face. There's a persistent structural resistant levels of child and family poverty, growing and solidifying inequality, rising levels of adversity relative to context, rapidly changing epidemiology, slowly adapting systems of care, the dominance of adult cost-driven healthcare policy and rapidly deployed market-driven reforms. Also, these intractable SES gaps, infant mortality, which lead to infant mortality rates that are differential, child morbidity, school readiness, high school graduation, life expectancies, all complicated further by racism and despair. There's this other thing too, which is the incremental mindsets. In the face of problems that demand transformative fixes or transformative changes, we tend to lead with fix-it and incremental thinking as opposed to transformational thinking or transformative thinking. So that's just again, we know how complicated these things are. Before I go really deeper into the discussion, I just want to let you know that we're using the EDI. While First 5LA and my center's commitment is to collect EDI for the entire county, it's going to take some time to get there. Early childhood population well-being measure is an early sentinel measure that predicts development across a life course. In other words, what happens in the first 5 years matters, and the effects that we are noting in the data will likely compound over time, as I stated before. This here is a reference to the presentation that Dr. Halpon presented in the first session. I wanted to raise it up just to remind you about the developmental trajectories and to illustrate how they compound over time, meaning you see the gaps get bigger. But this is how most of us see things. But I worked on my spatial mindset, thanks to Stevie Wonder. And this is the way I see things. As you can see, given different exposures, it is easy to see how a child living in a densely populated, poor urban ecosystem, that she will likely have different opportunities and threats than one in a more affluent community. This is the way our partners in LAUSD South saw it. When we started working with them and developing this infographic for them, they said it was like a game of chutes and ladders. And when you realize that it's like a game of chutes and ladders, you also realize that not all game boards are the same. And this is a tremendous equity challenge. So what am I driving home here is that we want you to understand population health. You need to start looking at this from various perspectives and different angles. These relationships are complex. Environmental influences are varied and include social and physical factors. It's difficult to measure. Policy changes can interrupt surveillance efforts. Causation is always hard to prove. And so this is the framing that we had, and one of the angles that we're working on as a group here. We want you to think about these drivers of change. Bill referenced earlier in his presentation the parental protective factors. Also, we had conversations as a group about the neighborhood city ecosystem thematic areas. These are these other drivers, the service, socioeconomic, social, political environments. And then we mentioned something about collective community capacity. You also know that we're hoping that as we improve these factors, that we'll see improvement in each of your cities moving forward. And so digging, it's time basically to rethink what we're doing. And so for the next few minutes before we get into the breakouts, it's time to think not only about the services, but also about the systems, to embrace complexity, to scale the change needed. Complex systems learn their way forward. And then also, because we want you to think about ways to address the structural factors. But in later sessions, we're going to be focusing on the environments that we prioritized in the previous meeting, the next one being on the service environment. So this is basically leading us into the second part here. This is Waldo Tobler's first law of geography. Everything is related to everything else, but near things are more related than distant things. Traditional social determinants of health. This is a model that we're pulling from Dr. Charlie Bruner. It's basically a 10 dimension risk assessment. These risks tend to cluster, resulting in concentrated deprivation. The way something becomes a risk factor is if it's plus or minus a standard deviation from the mean in any one of these domains. If it's a negative, it would be one deviation below, but if it's a positive, negative is one deviation above. If it's a negative, a positive factor, it's one standard deviation below the mean. So basically, we're turning all of these factors into a risk category. These risk categories can be classified further into level of risk. So there are neighborhoods that have 0 risks, some that have low, medium, high risk. And then this leads us to our first equity challenge. Now, all of you are in leadership positions. You've benefited from having time to reflect on society. But if you were to venture a guess, would you say that children of all races and ethnicities are equally distributed across all these types of communities? We all know that that's not the case. Here is an example of what that looks like when we distribute using our national data. You can see that people of color, this is the first obstacle children face. Large proportions of them live in neighborhoods with many more threats than their white counterparts. Unfortunately, this presents direct consequences on their developmental trajectories, their life outcomes, their earning potential, and the general well-being. The uprises we saw earlier in the year reflect that our affected populations understand this with much more urgency and nuance than those of us who may have lived in the same cities, but in completely different worlds. So the way you analyze this is you can see if you live in a neighborhood with 0 to no risk factors, the proportion of the children who are on developmentally vulnerable trajectories is much smaller than those who live in communities with higher 6 to 10 risk factors or the high risk. This right here, using the parlance of a scientist, this is a monotonic scale. It only goes in one direction, and it affects every single domain of development using the EDI. And then also in the summary, vulnerability in one or more domains. But this is a bleak way to look at things. So the question is, what about cities and communities that have committed to break these relationships? Do their efforts work? Can we measure it? And can we map it? And I only have one answer for that, and that is an affirmative hell yeah. This is what we've been doing, again, thanks to Stevie Wonder. As we adopt our spatial thinking, we can actually answer that. Here's a bivariate matrix, meaning it's a graph looking at 2 variables. On one axis, we have the measure of neighborhood risk. On the other, we have the kids on measures of kids on vulnerable developmental trajectories. As you can see in the chart right here on the right, you have most of the neighborhoods are in this gray area, meaning where you have low risk factors, you generally have the lowest proportion of kids on vulnerable developmental trajectories. And where you have high concentration of risk factors, you have high concentrations of kids on developmental vulnerability. But there are 2 areas on either end here. This is a measure of positive and negative deviance. And the following maps will show you what it looks like. Please note that 2% positive deviance is rare. And fortunately, we have a number of those gems in LA County. These are naturally occurring and self-organized laboratories of innovation. We as a group should look at them more closely because it is my underlying theory that if they are also if they're better organized to address child well-being in face of concentrated deprivation, then they will also be able and better organized to address the realities of COVID. And they're doing so much with so little, which is potentially going to be the much more common moving forward. So I'm going to go through the way that this looks like on a map, but then we'll get into a very brief conversation. So this is looking at the EDI mapped spatially for El Monte, the greater El Monte area. It's a single dimension map. It's just a population health outcome. Areas in light green are the areas with the lowest proportion of kids on vulnerable trajectories. Areas in dark green are the areas with the highest proportion of kids on developmentally vulnerable trajectories. This here is, you see some areas showing up here in dark green are areas that are actually having a negative impact on human development here, and it's probably likely to go through the life course. This is what that area looks like, just zooming into El Monte alone, of what it looks like at the measure of neighborhood risk. So you can see that there are this general pattern where the further north you go, the rates of risk kind of reduce, but there's nowhere in El Monte where you have not a place with 0 risk factors. And then you see some areas that have the highest risk. But when we compare the 2 together using our bivariate matrix, we're basically seeing some incredible positive deviance. This area here, the Potrero neighborhood, number 8, this is an area that has the highest concentration of risk, yet they have some of the best developmental outcomes in our United States sample. This is a place that we need to explore further. I am so grateful that El Monte is here with us in our learning exchange because I would love to figure out what's happening so well there. This is what the EDI looks like in South LA. Again, I showed you how to read that map. Dark areas are bad, light areas are better. This is what risk looks like in South LA. This is not new to anybody. We've all seen these kinds of maps before, but when we compare it to their population outcomes, we see a completely different picture. What we see here is positive deviance. Everything's trending towards blue. This is amazing. Westmont, also the Vermont Slauson area. Again, naturally occurring laboratories of innovation. We really want to dig deeper into there. Before we get into our little conversation here, I wanted to thank Nicole Pereira for running the analysis for the City Leader Learning Network. Nanas Arcadia do for helping us understand critical race theory, the Doris Duke Pop Change Learning Community, my text team, Magdalena Janus and Alfred Center for the EDI. And then I'm just going to show you very quickly that we have created maps for all of you with your distribution across neighborhood risk, as well as the proportion of census tracts by risk and how many of them have are vulnerable risk. This is very important. This is going to come to you later, but I just want to show you that for each of you, we created these the initial dashboard. So this is why I'm thanking Nikki for her work. Well, I know that we're up for time and we're about to break you up into groups. So I'm going to hand it back to Bill. Thank you all for the time that we had today. I really appreciate your thoughts, both your questions, Steve, and also your question, your response, Victor, as well as Stephanie, the question that you posed to me. So thank you very much. I appreciate it.